to take this opportunity and extend our festival congratulations and sincere greetings to nurses in the country. Recently, President Xi Jinping made an important instruction pointing out that after the outbreak of COVID-19, nurses in China have worked in harm's way, and they were really soldiers in white and made great contribution for the victory of the country against the COVID-19 and ensure the health and safety of people all over the world. Using their actual deeds and actions, they have demonstrated the professionalism, dedication, and great love. Today, we have with us the president of China Nursing Association and also the head of the Department of Nursing of the Union Hospital, as well as the 43rd Nightingale Medal winner, Madam Wu Xinjuan, from the PLA General Hospital, specifically the number 5 Medical Center, the senior nurse, and also the winner of the 45th Nightingale Medal, Madam Wang Xinhua, Madam Ji Dongmei, the head nurse of the internal department of the Geriatric Hospital of Beijing, and Mr. Li Jingze, nurse from the Department of Surgery ICU from Beijing Hospital. Let me first give you the update of the epidemic. Yesterday, between 0 and 24 o'clock, China's mainland reported that for newly increased confirmed case, the number is 1. It is an overseas imported case in Inner Mongolia. There's no new fatal case. And the newly increased suspected case numbers 1. It is in Shanghai, and it's an overseas imported suspected case. Yesterday, 27 people were cured and discharged from hospitals, and 503 close contacts were removed from medical observation. The number of severe cases increases by 1. For overseas importation, now there are remaining 80 confirmed cases, including 3 severe cases. For remaining suspected cases, the number is 3. In total, the number of confirmed cases is 1,691, and the number of cases cured and discharged from hospitals is 1,611. There's no fatal case. By the end of yesterday, China's mainland reported that for the remaining confirmed cases, the number is 115, including 10 severe cases. In total, the number of cases cured and discharged from hospitals is 78,171, and the total death tally is 4,633. In total, there are 82,919 cases confirmed and reported, and the remaining suspected cases numbers 3. In total, 737,599 close contacts are traced, and close contacts still under medical observation numbers 5,470. For asymptomatic infection, the new increase is 15, and there was no transfer to confirmed cases, and 35 cases were removed from medical observation yesterday, including 6 overseas imported. For asymptomatic infection still under medical observation, the number is 760, including 38 overseas imported. In total, from Hong Kong, Macau, and the Taiwan regions, the number of confirmed cases is 1,532, including from the Hong Kong SAR, 1,047, from the Macau SAR, 45, and from the Taiwan region, 440. Yesterday, for overseas importation, the confirmed cases had been cured and discharged cases from hospitals, and the total number is 1,611, with a cure rate exceeding 95%. Recently, we also find some sporadic cases domestically and clusters. This means that we should not slacken the efforts of prevention and control. Rather, the jurisdictions, the departments, the business units, and the individuals should implement the four-party accountability mechanism and identify the weak links and block the loopholes to build a strong defense line against the COVID-19. Also, the NHC has already sent a working team to Shulan to help the locality to conduct epidemiological survey and the epidemic control. Now, that's all for the update, and we will take the questions concerning today's topic. Please first identify yourself. Now the floor is open. First question. The second row on the right, the journalist in the middle, please. Thank you. With Wen Huibao. In April this year, WHO issued this year's nursing report, emphasizing the important role played by nurses in realizing the health-related SDGs. Also, in the fight against COVID-19, nurses play a very important role. So I'd like to learn from the speakers the performance of the nurses. We will have Madam Wu to take the question. Thank you. This year marks the 200th anniversary of the birth of Madam Florence Nightingale, and it is also the year to celebrate the achievements of the nurses and the midwives. WHO attaches great importance to the important roles played by the nurses. Nurses are serving the whole life cycle of any individual, from birth to death. Nurses are always there. Also, nurses are not just only engaged in the basic healthcare services, rather, in terms of the special healthcare services, the ICU intensive care, the health education, psychological support, and etc. Nurses are always there to help the people. Also, nurses should have the professionalism as well as the expertise of healthcare. This COVID-19 is also a test of their expertise. For example, the Union Hospital of Beijing also sent medical teams to work in the ICU wards in Tongji Hospital in Wuhan. The patients we received were all severe and critical cases, so it was indeed a daunting challenge for the nurses. So we came up with an integrated approach. So from the special healthcare to the psychological support, nurses are all engaged to provide high-quality healthcare services. Also, we can see that there are specialist nurses who used their expertise and skills and cooperate closely with the doctors, reducing the incidences of complications and once again demonstrating the important role of nurses in the fight against COVID-19. We can also see that this is a war engaging everybody. The health education among the general public is also very important. For example, for hand hygiene, the correct way of wearing masks, and etc. are all important knowledge and health tips to guard against the spread of the epidemic. For example, in the early days of the epidemic,
nurses took videos on the proper way of washing hands, wearing masks, and nurses disseminated these videos online. so as to improve the awareness and knowledge among the general public for proper personal protection. We know we are in a rapid aging process. Therefore, in the geriatric nursing, nurses play the majority part of the roles. For Chinese people, the older folk above 65 years old numbered 670 million, and the disabled older folk was almost half of the total old population. Usually, the senior citizens have underlying diseases such as bad sores and pneumonia. For those older patients who have been staying in bed for prolonged time, bad sores and pneumonia are commonly seen among the senior citizens and patients who have been staying in bed because of the diseases for a long time, leading to great burden on themselves and their families. Nurses were engaged in such disease prevention, provided proper guidance to the senior citizens, and such complications can therefore be avoided. Nurses have an important role to play on those fronts. More and more highly skilled nurses are working in outpatient clinics. For example, the abdominal dialysis have been provided by specialized nurses to patients. There are also diabetic patients who can get professional help from the specialized nurses on the administration of medicines and daily management of diabetes. And all these services can provide more guidance and support to more patients. In particular, in the fight against COVID-19, apart from the original outpatient nursing services provided, we also provide online nursing counseling and took questions from the chronic patients. Proper health guidance and solutions have been provided to chronic disease patients, just as Dr. Tedros, Director General of WHO, has rightly pointed out. Nurses are the backbone of the health system of all countries. Thank you. Next question goes to the journalist on the first row on the right side. Thank you. With Hong Kong Economic Herald, we know that the medical teams in Wuhan not only fought a successful battle against COVID-19, but also ensured zero infection among health workers. How did you realize the dual success? We've noticed on some of the TV reports in wards there has been the abrasion because of the long time wearing of masks among nurses. So how did you address the issue? Head nurse Ji Dongmei is taking the question. Thank you for your question that shows the profound concern and attention you've given to us. All the nurses have some basic knowledge on IPC. After we arrived in Wuhan, we spent a whole day to go through the training, the field training, to further refresh our skills and knowledge of IPC. The IPC expert and the head nurse have been supervising all the efforts, especially in the first week. Almost all the nurses, before we stepped into the wards, have to go through our inspections and checks. And also we ask them to go into the wards in pairs and leave the wards in pairs so that they can have the mutual check. What impressed us most were the practices by the patients, because patients will wear masks in front of the nurses. I remember once we stepped into a ward, the patient was on a telephone call with his family member, but once he found us coming in, he dropped the phone and she told the other one on the other end of the phone that I will call you back later. And in a hurry and a slurry of actions, he was looking for the mask and wore it. There was another older citizen. We told her that you should do more exercises. And the old grandpa asked us one question, that you asked me to do these exercises of respiration, and I am having deep breathing. Will that be an outlet of virus and that will pass on you? If so, please go away. I don't want to do such exercises. And we told her that it doesn't matter. We have a very good protection on these protective gears and masks. This colleague, when she told me this, she was in tears. She said, I've never imagined at the time of death or survival, the old grandma was not thinking of the safety of herself. Rather, she was thinking of the safety of us. There were so many similar things happened. Many patients prioritized the protection of nurses, even over their own safety. Well, in the blizzard of this unexpected outbreak, sometimes it was not us who were protecting our colleagues. Rather, the patients initiated to protect us. Once a patient told me that you are borrowed angels, we must return angels back to where you were from. When it comes to the greatest difficulty, I remember it was on the third day of the Lunar New Year. We arrived in Wuhan. Back then, within a week, the Beijing team opened 3 wards, 150 beds. So that was great pressure and a lot of workload. We had to work 6 hours on one shift, and the break was short as well. In the wards, many of us were running so that we can take care of each patient, even when we were running in our thick protective gears. That was very cold during February in Wuhan, but we were in a lot of sweat because we had to run to take care of each patient. But such situation didn't last long because later medical teams from across the country came to Wuhan, and soon we were relieved out of such great pressure. Thank you. Next question goes to the journalist on the first row on the left side. Thank you. With CNS, this year's theme of the Nurse Festival is coordinated with nurses. We know that in the response to natural disasters and health emergencies, nurses played an important role. I have a question for Director Wang Xinhua. You've been engaged in the Ebola response in Africa. So what was the impression that you could never forget? In 2014, Ebola outbreak occurred in West Africa. Within short months, it claimed the lives of tens of thousands. The situation was grim. In the initial stages, we didn't know the origin, the source. There were no vaccines. So whenever people talked about Ebola, it was almost the equivalence to death. When we received the task to assist Africa, we were psychologically prepared. But when it came to the time to go, we had the nervous feelings. We were involved in the SARS combat, the H1N1 response. However, Ebola was highly transmissive, and we had to confront it face to face without any previous experiences to refer to. It was an assignment that will be implemented in other countries. We didn't know what was waiting for us. everything was quite uncertain. We went to the Sierra Leone. It is a China-assisted hospital, and we would carry out efforts in that hospital. However, the hospital was not well equipped to take infectious disease patients.
So the first thing we need to do in West Africa is to improve the existing hospital facility and make it a hospital appropriate to receive highly contagious patients. So within 1 week, with the help of the Chinese embassy in Sierra Leone, we accomplished this task and demonstrated the China speed. Another challenge in West Africa is the high temperature and humid. In Sierra Leone, there's only one season, that is the summer, and at that time it was the raining season, and every day we need to work under the 35 degrees high temperature, and every step we need to take is full of sweat, and we were joking that every day we could enjoy free sauna. So we kept the optimism and the strong and high morale. One female patient left me with a great impression. Her husband and daughter died because of Ebola. When she was first hospitalized, she didn't have any hope for life. But we were determined to save her. As we learned that she was a Muslim, we gave her the necessary devices to pay worship. And every time when our nurses took care of her, we gave her great encouragement by sending her a card saying cheers. And finally, she recovered. She was in tears, and she said to us upon her discharge that we were really the angels to her. We were really touched. Okay, let's continue. On the left, on the second row, the reporter close to the aisle, please. Thank you. With CETV. My question is for Mr. Li Jingze. Our question is, why did you choose to be a nurse? And with your Wuhan experience, what are the new enlightenments that you have had? Thank you for your question. When I was filling the form to apply for universities, together with my parents, I made the decision to provide health care. And in the light of the admission situation, I chose the nursing profession. This is the 4th year I started my professional career, and in my hospital, we enjoy the tradition of dedication and great love and care to the patients. For years, nurses from the Beijing hospital are making their due contribution to the country. I was sent to Wuhan on the 2nd day of the Chinese Lunar New Year. At that time, I was determined, as I was about to contribute to the epidemic fight, but I was also a little bit concerned, as I didn't know if I have the enough capacity to do so. When I arrived in Wuhan, in particular in the hospital, I strongly felt the importance of my work. I was needed, and I was also recognized by the patients and the physicians. So with the Wuhan experience, I become more aware of the importance of nursing, and also I had a deeper understanding of our profession. I remember that once when I was having the medical practice on the patient. The patient told me that, don't worry if you can't give me the right practice for the first time. Just take your time, and I'm confident in you. So this was really touching to me. To rescue lives is not only the life-saving skills and practices. Instead, it is also about the daily chores and also giving confidence and winning trust from the patients. Now the epidemic control has become the normalcy, and I believe that in the future there will be more and more needs for the nurses. As a nurse, I will make every effort to improve my expertise and professionalism. Okay, thank you. Let's continue. On the right, on the fourth row, the gentleman in the middle, please. Thank you. With CCTV News, today marks the 109th International Nurses Day. I'd like to take the chance to express our appreciation and respect to the nurses. My question is, what are the major tasks that you do during your stay in Wuhan? And what is the biggest enlightenment or harvest that you have had in your Wuhan experience? We will have Madam Ji Dongmei to take the question. Talking about our work in Wuhan, from the food serving to the specialist healthcare, they are all tasks for nurses. Also, sometimes when we have elderly patients who do not know how to use the mobile phones to communicate, then nurses are also messengers of communication. And also, we will turn on the TV or the mobile phones for the elderly patients so that they can communicate with their families and their friends. Sometimes we also read the family letters to the patients. Every time when we do this, we can see the tears in the patient's eyes. We know that it's a moment of happiness and also a moment of a touching moment. And such care and support have encouraged the elderly patients. Also, in high-risk practices like intubation, in the preparation, nurses, more or less, were also concerned. However, when we were faced with the patients, our practices were consistent, and whatever we thought in our mind was just the patients. As you know, for incubation, usually it was the severe or critical case, and the nurses didn't have the luxury of time and effort or energy to think about other things. When I was in Wuhan, I was also touched as we have been working shoulder by shoulder with the local nursing colleagues, and we had to wear masks all the time. When patients were discharged, they asked whether we could take off the masks and show our faces to them, but it was a pity. I also felt sorry for that. I found that there was once a news report in which the patients say, if you think the stars are shining in the sky, and that is because you have not noticed the shinings in the eyes of the nurses. Well, on the day of the International Nurses Day, when the nurses can take off the masks, you will also see beautiful faces and the bright eyes. Talking about our experience in Wuhan, I would say that it was always a moment of love and care on the International Women's Day. Because of our work, 2 nurses were unable to catch the shuttle bus back to the hotel.
It was raining. They couldn't walk back, so they phoned the driver. When they stepped out of the hospital, they found it was not a shuttle bus waiting for them. Rather, it was the private car of the driver. The driver was already off the duty and returned the shuttle bus, but upon receiving the call, she dropped his chopsticks and bowls and immediately came to the hospital to pick them up. He said that you come to help us. It is incumbent on me to return with this little gratitude. In the 65 days when we were staying with the patients, the family members of the patients, the Wuhan colleagues, the Wuhan citizens, there were so many things happened. It might be minor things, but in the most adverse time, I saw the best of people. I also like to take this opportunity to say thank you to all those colleagues who have been working with us in Wuhan, for all those logistic staff who have helped us, to all those heroic Wuhan people. I salute you. Thank you. Next question goes to the journalist on the 3rd row on the left side. Thank you. With the CCTV, Society and Law Channel, among the 40,000 plus health workers, they came from the local hospitals and also the military. In every disaster, we see the people from the army. So my question goes to Director Wang Xinhua. As one from the People's Liberation Army General Hospital, what's your understanding of responsibility? When I'm in my army suit, I am a warrior. When I am in the white gown, I am a nurse. We shoulder the responsibility of rescuing life. I'm also an army woman. If it is peaceful time, then we must ensure the peace of the people. If it is a wartime, we must protect our country. It is incumbent on us to have the sound professional skills, the strong psychological responsibility, and also a strong physique, so that whenever we are called upon, we can attend the fight in the battle, whatever battle it is. I remember in Philippine typhoon response, I was involved in the task. It was within 4 hours between the accepting of the receiving of the order and the leaving of my doorstep. The reason why I could make everything ready within 4 hours, it was because on a daily basis we have a routine and normal exercises and preparation and exercises and drills. For me, I'm a nurse. In my white gowns, I am a warrior in my army suit. No matter what peril and danger are awaiting us, I carry with me only the sense of responsibility of an army man. I remember when I attended the Philippine typhoon response relief efforts, I was 3 months away from the completion of a surgery. My husband was very worried about my own health, and he asked me to stay. But I thought it is incumbent on an army man to follow the order, to obey the discipline. I think 4,000 health workers from the military hospitals were involved in these efforts for helping Wuhan in face of danger. Just like one of our colleagues has mentioned, in time of the greatest difficulty, please feel assured that you have us behind you. As a nursing professional in the PLA hospital, it is my great honor to be at this position. Next question, please. Thank you. With the cover news. My question also goes to Mr. Li Jingze. We know that most of the nurses were female colleagues, but there were also gentlemen nurses like you. What are the differences between the lady nurses and the gentlemen nurses? And how do you want to bring out your unique merits? Thank you for your question. In the 151 medical teams from Beijing Hospital, 103 nurses, and there were only 5 gentlemen nurses. We have shown our specialized professional services. In the nursing services provided to patients, we had different and complementary advantages between the gentlemen and the lady nurses. In psychological and physical fronts, we may have stronger advantages. We have stronger physique. Our mood may not be easily fluctuating. We are good at operating devices. It might be the innate advantage of men. And all these have been brought into full play in the Wuhan assistance. When we were taking care of the severe cases to prevent the bad sores among patients every 2 hours, we will help the patients to change the body position. If the patient is heavy, then it may need 3 to 4 lady nurses to turn him or her, but it takes only 2 gentlemen nurses to do the work. And also when it comes to the male patient, once there was such a patient who was using ECMO and almost all these sophisticated tubes, on him there were almost 10 tubes. 5 of us male nurses were involved in the sputum collection, the replacement of all the liquids, the monitoring of glucose and the ACT, and all these have to be done continuously. Once we are in the ward, it is a fight. We can never afford a minute of rest. If we transfer the patient to take other checks, the respirators, the ECG monitor should also be equipped. It is highly intensive work, and the gentlemen nurses might be physically more advantageous to take over the tasks. And all these must be built on the repeated exercises and learning so that we can give full play to such advantages. Similarly, there are advantages for the lady nurses. They are more compassionate, they are more detailed, and they can easily identify and associate with the feeling and emotion of patients. With people's mindset on the nursing concept is changing, we see more and more gentlemen nurses in ICU, in the surgery theaters, and mental disease treatment. All these aspects need the involvement of gentlemen nurses so that we have a balanced, efficient team with a better atmosphere. I suggest that more gentlemen can be involved in this great undertaking. Thank you. The last question for the day goes to the journalist on the 3rd row on the left side, the journalist in white. Thank you. With the China Youth Daily, I have a question for President Wu Xinjian. What is the status quo of the nursing development in China in face of a public health emergency? What are the suggestions for the building of a nursing team? Thank you for your care on the nursing development in China, being it in the fight against the 2003 SARS or the COVID-19 response. In face of public health emergencies, we saw the great efforts contributed by nurses. In the medical teams assisting Wuhan, the nurses took up almost 70% of the total workforce. Over the years, nursing has been developed rapidly in China. The number of nurses have been increasing at hundreds of thousands on a yearly basis. In 2019, the number of nurses increased by 350,000 compared with that of the previous year. At the end of 2019, the registered nurses 4.45 million per thousand people's possession of a nurse numbered 70% of them have a college degree and above. Compared with 10 years ago, the total number increased by one-fold.
It is fair to say that the development of nursing is quite sound. However, we are also faced with some structural problems. For instance, in some community-based healthcare facilities in remote areas, as well as in rural areas, the number of nurses is inadequate. Also, in the community-level healthcare centers, they play a very important role in NCD management, health education, and disease prevention. Nurses are expected to play an even greater role. I'd like to make some suggestions in three aspects. First, in school education and training in order to satisfy the needs in the society. In terms of quantity and the quality, I believe we should do more to satisfy the needs in the society. So it is hoped that with advocacy, the whole society will be better informed of the nursing profession so that more young people can join us in nursing. And also the setup of the nursing program in the universities and the colleges should be rational. For example, in the fight against the COVID-19, we were also enlightened that in terms of the course design, there should be courses like public health and emergency response added. Furthermore, in the light of the actual needs in the society for rehabilitation care, community care, ICU, and also the geriatrics care, we should invest more. Furthermore, I'd like to mention that there should be sound synergy cultivated between the universities and the hospitals. The nursing emphasizes a lot on the actual practices. I hope our nursing students can be engaged in the practices earlier and learn by doing. Also, for the continuing education of the nurses also find it necessary to constantly upgrade or update their knowledge. We hope that we can be better equipped with the opportunities to have further training and education. Also, the professional development of nurses should be encouraged so that nurses can become the experts of care in specific disciplines. In the fight against the COVID-19, we can see that the specialist nurses have played very important roles. I also hope that the capacity building of the nursing profession can get the support and interest from the society. You know, nurses work very hard and they work long hours and they don't have many holidays, and they work around the clock to provide care to the patients. Also, about 98% of the existing nurses were female. Apart from their profession, they are also mothers and daughters in the family. So I sincerely hope that in terms of the remuneration package and the professional career development, nurses can enjoy more opportunities. Yesterday, we felt greatly encouraged as President Xi Jinping sent the festival greetings to the nurses. We felt so excited. The 4.45 million nurses in China really appreciate the care and the support rendered to us from the party and the government. President Xi Jinping also emphasizes that the governments at all levels should show care to the nurses, and the capacity building of the nursing profession should be identified as one of the priorities in the development. We are confident that with the guidance and the support from the party and the government, the nursing profession will be soundly promoted, and the nurses will make greater contribution to the development of a greater country. Okay, thank you. In today's press conference, we have speakers sharing with us their professional experience. I'd like to say thank you again to all of them and pay tribute to all the soldiers in white. For tomorrow's press conference, we will focus on the normalcy of epidemic prevention and control. We will invite speakers from NHC and China CDC to take questions from the journalists, and we welcome your participation. That's all for today. Thank you very much.